Following a suit from the MEC of the Limpopo campaign, Mjolo sleeps better when protected, to ramp up vaccination among the 18 and 34-year-old cohort. The Western Cape Health MEC takes her drive to Khayelitsha's popular entertainment place, Rands, to encourage the youth to get inoculated with the hashtag Jabs Before Joel campaign. Nasiphi Same joins us live now from the area. Nasiphi, a very good afternoon to you. Tell us more about this campaign and what it aims to do.
Well, Tammy, from where we're standing, which is Rands, it's obviously a far cry from what people that have visited this popular entertainment place know it as. Behind me, as you can see, people are getting inoculated, and the Minister, or rather MEC of Health in the Western Cape, was here, moving, or rather pushing her campaign, Jabs Before Joel, and she's saying that the younger people, or rather we have seen a lower number of people vaccinating between the ages of 18 and 34, and she is encouraging them to get their vaccinations. And they are moving out of the healthcare facilities, the traditional healthcare facilities where people are usually getting their vaccines. But to talk to us more about vaccine hesitancy in Khayelitsha and some of the dynamics, I'm joined here by Vali from the Khayelitsha Eastern structure. Vali, talk to us about the number of people that are vaccinating, or rather break down the figures for us.
So it's Rizia Vali, and I'm from the Khayelitsha Eastern Substructure Office and the vaccination lead in the Khayelitsha area. So yes, you are very right in terms of the lower uptake in terms of registrations. And just to break that down for you, if we're looking at the 60 years and older, we've registered, about 47% has registered. And then if we're looking at the 50 to 59-year-olds, there's about 42% that has registered. And then, what this event is for, the youth in the Khayelitsha area, it's from the 18 to 34-year-olds. We've registered 4.7%. So that age band has just recently joined, has gone live with being able to be vaccinated. And so, yes, it is significantly low in the Khayelitsha area, and so that's why we have collaborated with Rands to be able to attract our youth, to be able to come to the site, making it more accessible for them. It's a site that they know, Jabs Before Joel, so basically coming to the site, feeling safer in this environment because they're used to the environment. And yes, so just an appeal to the youth in the Khayelitsha area to please come today to Rands. We are here. We will register and vaccinate you on site. So please do come to Rands.
So what are some of the reasons behind the vaccine hesitancy in Khayelitsha particularly? I mean, there's about 19 informal settlements within Khayelitsha.
So, I think the reports that we've been receiving is that fear. So there's a great fear within the community. They're wanting to first see what is the outcomes of all the other people that has been vaccinated, to see how effective the vaccines really is. So I think fear is one of the factors. There's a lot of socio-economic factors within the Khayelitsha area. Accessibility, so to be able to go to the sites and get to the sites is maybe one of the factors. And then, I think it's also from our side as the health department to try and break down, the reasons for those fears. And so there's been a lot of activations, advocacy, education, and trying to have these dialogues with the community members to find out what are the reasons behind those fears. And so, we've been with the faith-based organizations. We've been linking quite significantly with them to be able to motivate, the congregants to come to to be vaccinated, a lot of them were also hesitant, and they're opening up. So there is these various conversations that are being had, and yes, so we're in the process, and just again an appeal to our Khayelitsha population that if you are unsure, if you are feeling uncertain about the vaccines, you're most welcome to come to any of our health facilities. You can speak to the clinicians over there to be able to, to address what your concerns are.
Thank you so much. From the Khayelitsha Eastern structure, giving us an update regarding the activations and taking their vaccine drives and getting people inoculated outside of the healthcare facilities. As heard earlier, many of the healthcare facilities in Khayelitsha are designated vaccination sites, but because of the vaccine hesitancy and people not registering, they are moving their activations outside. And just on Friday, they are saying that they will be going to a SASSA pay point where they will be registering and inoculating people who are waiting for their SASSA payouts.
Thank you very much for that update. Certainly some innovative ways that are being thought of to try and encourage the youth to vaccinate, and one such drive that we're seeing now in the Western Cape.